Hey there, it's Dr. Sweeney, and a common area that we have people coming into our office is having neck problems. And a common question I get asked is, what exercises or what things can I be doing to help loosen up my neck? And I'm very simple with what I say to do, and a lot of them have to do with just stretching, things that we can do more than strengthening exercises, because with the neck we don't necessarily want to do a whole lot of strengthening. It's more loosening up the tension that's already there and present there. So my biggest recommendation is just starting with what I call simple ranges of motion. So the simple ranges of motion are bringing our head forward in a forward position, going to the left, to the right, right ear to your right shoulder, left ear to your left shoulder. A common one that people always want to do is a neck roll. I do not like neck rolls, and I don't like neck rolls is because what you're doing is you're taking your neck through multiple ranges of motion all at once that, even though it can move in that direction, is not designed to move in that direction, and it's not good. It can actually tear loose connective tissue, the ligaments, and create additional stresses and strain on the neck. So for me, I just encourage going forward. And what I like to do sometimes is just add a little bit of extra. So I'll grab my head and just kind of traction it forward. And again, go to the left, and I'm going to add a little bit extra. I'm going to kind of just gently push on my jaw right through there. I'm going to go to the right, take it all the way to the right. I'm going to look up, bringing it back like that. And again, right ear and left shoulder. If we want to add an additional element, what we can do is grab onto a chair where I'm sitting just like this. And as I bring my head forward, as I'm doing this now, I'm tractioning, and I can feel that a little bit further down into my left shoulder right through here. And again, the same way. If I grab with my left arm underneath the seat and look down, and then look off to the left, look to the opposing side, looking down, I can feel additional stress and strain right through there as that starts to pull that tension right through there. We want to look at our posture and what we're doing to help open up our chest muscles. So again, another stretch I like to work on is what I call a lace stretch. You're going to take your fingers and you're going to lace your hands together, and I extend my arms back and down at the same moment. So I bring them back and down, retracting my shoulder down, and then I gently raise that up. Now what that does is I can feel that all in my pecs right through there. I can feel it right in between my shoulder blades. And what that does is helps to bring my shoulders back. As it brings my shoulder back, it helps to bring my head back. So again, we've got a smaller structure as we look at between our head and our neck versus the mass of our entire body. But if our entire body is slumping or falling forward, we want to look at what we can do to help bring our posture back into an open position. Another thing that we can do is, I'm a big fan of foam rollers, but taking a roller, you can take a long cylindrical 6-inch or 4-inch roller, foam roller that's maybe 3 feet if you have one at home. I don't have one right here to demonstrate, but what you would do is lay on the ground with it lengthways and bring your arms open like this. What that does is what I'm achieving right here by laying across this table, this bench, is that opens up my chest. Again, by having that leverage right through there, that opens up that upper part of the shoulder area, the top of the thoracic spine, and takes a lot of tension out of our neck area. My recommendation is if you ever go to a massage therapist, I tell all of my patients to have them not do any work in your neck, because a lot of times even the most well-intentioned can destabilize some of the vertebrae in your neck. If you're dealing with some issues and I say go ahead and do that, make sure that you got an appointment to come back in and get checked by me and within the next couple of days following a massage, so we can make sure that your neck stays in alignment. Dr. Sweeney, here to help.